Which of the following is not a function of luteinizing hormone, LH, in a menstruating female? A. It stimulates the maturation of follicles within the ovary. B. It triggers the release of the mature egg during ovulation. C. It stimulates the production of estrogen by the ovary. D. It triggers the development of the corpus luteum. The answer is A. It stimulates the maturation of follicles within the ovary. Luteinizing hormone stimulates the production of estrogen by the ovary, triggers the release of the mature egg during ovulation, and then stimulates the ruptured follicle to develop into the corpus luteum, the structure responsible for providing progesterone to the endometrium in preparation for implantation, if a pregnancy were to occur. Which of the following is a normal value for luteinizing hormone, LH, in an adult female experiencing normal menstrual cycles? A. 25.4 mAu, L. B. 1.5 mAu, L. C. 76.3 mAu, L. D. All of these. The answer is D. All of these. In a menstruating female, LH values can vary widely during the menstrual cycle. It is its highest at the peak of the menstrual cycle 8.7 to 76.3 mAu, L, and lowest during the luteal phase of the menstrual cycle mAu, L. Which of the following is a normal value for luteinizing hormone, LH, in an adult male? A. 0.2 mAu, L. B. 14.5 mAu, L. C. 11.0 mAu, L. D. 26.7 mAu, L. The answer is C. 11.0 mAu, L. Normal LH values for an adult male range from 1.8 to 12.0 mAu, L. These can be slightly lower in prepubescent males. Adult levels above 12.0 mAu, L can be seen in certain conditions of gonadal dysfunction, such as hypogonadism. What is the function of luteinizing hormone, LH, in an adult male? A. It triggers the conversion of testosterone into dihydrotestosterone. B. It triggers the production of testosterone by the Leydig cells in the testes. C. It triggers sperm production in the seminiferous tubules. D. It triggers the production of testosterone by the Sertoli cells of the testes. The answer is B. It triggers the production of testosterone by the Leydig cells in the testes. In an adult male, luteinizing hormone triggers the production of testosterone by the Leydig, interstitial, cells in the testes. Testosterone is converted to DHT, dihydrotestosterone, by the enzyme 5-alpha reductase. Sperm production and maturation is triggered by follicle-stimulating hormone, FSH, rather than LH in adult males. Which of the following is the most biologically active form of estrogen? A. Estriol. B. Progesterone. C. Estradiol. D. Estrone. The answer is C. Estradiol. The most prevalent and biologically active estrogen in an adult female is estradiol, E2. Estrone, E1, estradiol, E2, and estriol, E3, are three endogenously produced estrogens. Estradiol, E2, is produced by the dominant ovarian follicle during the monthly menstrual cycle and is the most potent natural estrogen. Estrone, E1, is the dominant form of estrogen during menopause. It is produced in small quantities by the ovary and the adrenal glands, and is principally derived by the peripheral conversion of androstenedione in adipose tissue. Estradiol is more prevalent in premenopausal women who are not pregnant, while estriol and estrol are both only elevated during pregnancy. Progesterone is not a form of estrogen, but rather a distinct progestogen reproductive hormone. What is the most prevalent form of circulating estrogen in a postmenopausal female? A. Estradiol. B. Estrone. C. Estrel. D. Estriol. The answer is B. Estrone. After menopause, the most predominant form of circulating estrogen is estrone, E1. Estrone, E1, estradiol, E2, and estriol, E3, are three endogenously produced estrogens. Estradiol, E2, is produced by the dominant ovarian follicle during the monthly menstrual cycle and is the most potent natural estrogen. Estrone, E1, is the dominant form of estrogen during menopause. It is produced in small quantities by the ovary and the adrenal glands, and is principally derived by the peripheral conversion of androstenedione in adipose tissue. Estradiol is more prevalent in premenopausal women who are not pregnant, while estriol and estrol are both only elevated during pregnancy. What form of estrogen is only present in pregnant females? A. Estrone, E1. B. Estrol, E4. C. Estriol, E3. D. Estradiol, E2. The answer is B. Estrol, E4. The only form of estrogen that is exclusively present in pregnant women is estrol, E4. Estriol is produced in quantities that are notable only during pregnancy. Estrol is produced at very high levels in the fetal liver, and it has been suggested that this estrogen may have a protective effect in the fetus by insulating it from the maternal estrogens. What enzyme is responsible for the conversion of androgens into estrogen? A. Amylase. B. Aromatase. C. Protease. D. 5-alpha reductase. The answer is B. Aromatase. The conversion of androgens into estrogen is performed by aromatase, also known as estrogen synthetase or estrogen synthase. 5-alpha reductase is responsible for the conversion of testosterone to dihydrotestosterone. Amylase is a salivary enzyme that breaks down starches during mastication, and protease is a digestive enzyme that aids in the breakdown of proteins. Which cells in the male reproductive tract produce testosterone? A. Spermatogenic cells. B. Leydig cells. C. Wolffian cells. D. Sertoli cells. The answer is B. Leydig cells. Leydig cells, located in the testes adjacent to the seminiferous tubules, secrete testosterone in response to luteinizing hormone, LH. Sertoli cells are also adjacent to the seminiferous tubules. They play a role in stimulating spermatogenesis in spermatogenic cells. Wolffian cells are part of the fetal male reproductive tract and do not produce testosterone. Which of the following structures are formed from the embryological Wolffian ducts? A. The seminal vesicles. B. The epididymis. C. The vas deferens. D. All of these are correct. The answer is D. All of these are correct.